Hello folks, my name is Joe. I've just had hip replacement surgery a week ago. So a week ago today, I was going into the hospital to have my left hip replaced. I still have the bandage on, same bandage that they put on in the hospital. So I had total hip replacement on this side. So this is a week later. At this point, I'm able to walk just with a cane. So if I'm walking around the house, all I need at this point is just the cane. For the first few days, I needed a walker, but now I can do pretty much everything with just the cane. I used the narcotic pain medication for about 3 days after getting home from the hospital. And since then, I've just been using Tylenols. Okay guys, when you're walking with a cane, if this is your operated leg, this is my bad leg, this is the one that had the hip replaced. When you're walking with a cane, the cane's going to be in the opposite hand. So this is the bad leg left, cane is in the right. When you walk, the tip of the cane needs to go down before your leg goes forward. So it's going to be cane, then the foot of the bad leg. So getting around the house is pretty easy. Okay, so getting around the house is pretty easy with just the cane. Okay, once I'm over here in the kitchen, I can sort of set the cane aside, and if I need to move around the kitchen, I can sort of use one hand around the countertop. If I'm cooking, I've got both hands free. If I'm just moving a short distance, I can sort of use the countertop, sort of don't really need the cane. But if I'm going to go from the kitchen area to another room, then I'm going to need the cane. So right around in this area here, I can set the cane aside, do the cooking and so forth. If I'm just moving a short distance, I don't really need any help here. Now, in the bathroom, it's helpful if you have one of these raised toilet seats. And if you have one of these raised toilet seats, you can use that. And that's very helpful. You can use your walker, and what you do there, put the walker there, and then you can use these handles to get on and off of the toilet. So the walker has a nice design to allow you to use these handles on either side. Okay, now I'm going to talk about getting in and out of a chair. It's best if you have a chair that has handles on either side. So instead of lowering yourself down with a cane, what you can do, you can put your hands on these handles here and sort of lower yourself in. Likewise, when you're getting up, you press here, use your good leg. When you're standing up, you can use your cane. So sitting down, use the handles. Then getting back up, use the handles, and then you're back to your cane. Okay guys, I'm going to show you how to get up and down stairs. It's very important that you not fall, especially after hip surgery. So to be safe here, when you're going up, you want to lead with your good leg, not the one that's been operated on. So the way to go up safely, you need a cane, and your staircase should have a handrail here. So what you're going to do, put your left hand on the handrail here. My handrail is on this side here. Put the cane up on the first step. Push down with your left hand. Push down with your right hand, and then take the good leg and go up first. Then you drag the bad leg behind. Then you move your left hand up, move the cane up to the next step. You're going to go up with your good, drag the bad one behind. So you're going to move the cane up. So you're able to press with both your left hand and your right hand. Good leg, drag the bad one behind. So cane moves up, good leg, drag the bad one behind. If you have a really weak bad leg and you're concerned that you're going to fall, you can actually put a whole lot of weight on this side. You can put your whole forearm there, then put the tip of the cane up here. So now you're carrying a lot of your weight, both on the left and the right. Take the good leg up, drag the bad leg behind, move the cane up. Again, you can put a lot of weight here on your left arm. Bring the good leg up, drag the bad one behind. Okay, now we're going to talk about coming down the steps. When you're coming down, it's going to be the bad leg first. So the rule to remember is it's good going up, it's bad going down. So we're going down, it's going to be bad leg first. So what we want to do, we want to have a good grip here on the handrail. I'm going to put the tip of this cane down. So I've got the bad leg here, but I'm well supported on both sides. So it's going to be bad, good. Take the cane down, bad, good. Take the cane down, bad, good. So let the cane hit first, bad, good. And again, you can put a lot of weight over here on the handrail. If you need to, just lay your whole forearm down. So it's going to be cane, bad, good, bad, good, bad, good, bad, good, bad. Once you've used the cane, you now have one hand free. So if you need to carry something over to the table, like a cup of coffee, you've got one hand free. You can also carry a plate of food if you need to carry that over to the table. If you're just dealing with stuff here around the kitchen, you can probably just put your cane aside and you've got both hands free for doing stuff there. Okay, now we're going to talk about bathing. In my case, the doctor told me to not take a shower for 2 weeks, and he wanted to keep this bandage thing completely dry. So the way to bathe then is I take a wash rag, put soap on it in the sink, get the wash rag wet. I'm going to have to just do a scrub down with the washcloth here, rinse it out, maybe put more soap on, again, scrub all of the private areas, rinse it all out. And again, with the wash rag, you'll of course have to take your clothes off. You scrub all of those areas that might stink, rinse it all out. Scrub all of those areas that might stink, rinse it all out. So you just have to do that until the doctor allows you to get this incision area wet. Okay, now let's talk about sleeping. Getting in and out of the bed. You might have somebody that can help you here, maybe you don't. But this is the weak leg, the operated leg. It's a little bit difficult to get that leg up in the bed. What you can do, you can use your good one to kind of hook behind it to help pull the bad leg up into the bed. Once you're up here, you're probably going to have to sleep on the side that did not have the operation. And it's probably going to be more comfortable if you have a pillow between your knees. And if you're going to put a pillow between your knees, it's best to do that before you turn over onto your side, because this leg is going to be kind of weak. Okay, now we're going to talk about what do you do when you're stuck at home. You're basically going to be homebound for a couple of weeks, and what are you going to do to keep from going crazy? Well, you have to focus on the things you can do, not on all those things that you cannot do. So you need to think about what can I do and how could I be useful while I'm stuck here at the house. What are some of the things you could do? You could clean up all your computer files, you could delete duplicate digital photos, organize your digital photos, you could work on organizing a family tree. There's a whole lot of things you could do. You could make a list of all of those things and then work on those. Of course, you can read and you can watch television. Now, you may not be able to play golf, but one of the things you can do while you're at home is, if you've got a putting cup, you know, you could practice doing your golf putting if you wanted to do that. If you were a fitness freak, you can use either dumbbells. You know, if you have dumbbells, you can do dumbbell exercises, all sorts of dumbbell exercises. If you have stretchy bands, you can do a bunch of exercises involving stretchy bands. So, you know, you can still do some upper body exercise, even with stuff like stretchy bands or something like that. So, you know, it's bad that you're stuck in the house. Once you, about a week has passed, you should be able to take your cane and go outside and go walking around the neighborhood. Okay, now that you've had your operation, you're going to be stuck here at the house for probably at least a couple of weeks. It's handy to have a good, comfortable recliner chair, and it's also handy if it's got a handrail on each side so you can get into your chair. And it's also kind of nice if you can do something to elevate your legs and maybe even elevate more by putting a pillow underneath. But it's good to have a comfortable chair. Sitting next to my chair, I've got my reading glasses and I've got some books to read, and of course you want to have your cell phone, maybe a charger for the cell phone. And so having a nice comfortable chair, especially one where you can elevate your leg, it's a good thing. Okay, now I'm going to talk about leg swelling. This is the leg that was operated on. You can see that it is very swollen compared to the non-operated leg. So I was told this is pretty normal, but you can see it's quite a difference between the operated leg and the other one. So anyway, I mean, you can try to deal with this by elevating it, putting ice on it, but this fairly big dramatic difference you see right here, I was told it was not abnormal. Okay guys, if you're thinking about having hip surgery or knee replacement or something like that, I think it's a good idea before you have that surgery to practice with a cane, practice with a walker, practice going up and down the stairs with a cane so that you can become coordinated at all of that and have it all in muscle memory before you have to do it with the joint replacement. So guys, if your bad leg or your operated leg is your left one, the cane's going to be in your right hand. The tip needs to hit the ground before the foot of your operated leg. If you're climbing the stairs, practice so that you can carry your weight on both your left and right arms, you know, before you put your leg down.